Our new emergency department tracking solution, LaunchPoint, displays critical data at a glance, such as vital signs, resuscitation status, and allergy information, enabling our team to anticipate our patients' needs and ensure prompt action is taken, as well as providing a clear display of treatments and activities for every patient. The clinical teams will use this platform to manage the care and treatment of their patients while they're in the emergency department, navigating back here to order new investigations, review results, and document in the patient clinical record. Our patient flow coordinators will also use LaunchPoint to manage the flow of patient activity within the department. Actions such as decisions to admit and bed requests can be actioned easily from here without the need to navigate through multiple screens. The ED team will have access to the emergency department real-time dashboard, which gives a clear overview of the current activity within the department. This function provides an at-a-glance view of the demand and capacity, and can be used to direct the nurses and clinicians to the areas which require more focused management to facilitate patient flow. We understand that when our patients arrive to the emergency department, they need to be assessed and treated as quickly as possible. Having early notice that our sickest patients are on their way gives our teams the best opportunity to prepare for their arrival. Currently, this information is documented on a paper form known as ASHICE, which stands for Age, Sex, History, Injuries, Condition, and Events Leading Up to. At present, the paper form is walked from the main A&E department around to the resus team. In the future, the paper form will give way to a digital version, allowing the team to document this critical information directly onto LaunchPoint, the ED overview of our SASH Cerner EPR. This information will then form part of the patient's record. Our new EPR highlights these patients in a designated zone called pre-arrival, where our resus team will be able to see the ASHICE handover, giving them advance notice of priority patients and allowing them to prepare appropriate equipment and assembled staff ready for arrival. Georgia and Magda are in the emergency department, where every patient undergoes a triage process to determine the severity of their condition, enabling the team to begin treating them accordingly. Using our new SASH Cerner EPR, our team will navigate to the activities column in LaunchPoint, where triage and assessments can be opened and documented. The triage and assessment form incorporates all the key areas required for a standardised, comprehensive and rapid first assessment for our patients. Assessments such as those for pain, frailty, falls and mental health can be documented directly from the triage form, enabling the nurse to make complex clinical decisions quickly, avoiding any delay in treatment. The current paper front sheet with a handwritten task list will give way to a digital ordering page, which is now accessible directly from the triage form. One electronic folder can be accessed from here containing triage bloods and investigations, allowing the nurse to request initial tests and diagnostics at the first assessment with ease. Whilst in the emergency department, the ED team provide Georgia and Magda with ongoing care and treatment. The patient safety checklist is completed by the nursing team, with the patient at the bedside at every hour of their stay. This is automatically generated as a task in the nursing activities column on LaunchPoint. This checklist ensures that every aspect of basic care, comfort and safety of the patient are being met. All care and treatment for our patients can be documented within the assessment areas of the documentation page, giving a clear view of the patient's status, enabling the team to see trends in the patient condition. Assessments such as pressure care, wound and skin assessment, respiratory and neurological assessments can be documented here, and this information will then also be seen once a clinical note is created, giving a comprehensive view of the interventions that have taken place. The new Quick Orders page in our new SASH Cerner EPR enables the ED team to rapidly order investigations and diagnostic tests for Magda and Georgia. In this Quick Orders page, medications can be prescribed as well as care plans ordered, which will inform ongoing care and treatment. The page has been designed so that the most frequently requested blood tests and investigations can be easily selected in order to reduce treatment delays. Once these orders have been placed, they are shown on LaunchPoint and their progress can be tracked with the indication bars within the columns. As results become available, the ED team can use these quick links to review and endorse the results and document further treatment in the digital record. Georgia and Magda's treatment and care within the emergency department is now complete. Magda's doctor has made the decision to refer her to the surgical team for further specialist assessment within the department, and does this via the hospital bleep system. He gives a verbal handover to the surgical team regarding the investigations and diagnostics she has received. Using the new LaunchPoint system, the clinician will open the referrals form and request a referral to the surgical team. This and other referrals can be seen in the referrals column. A bed request is then made for Magda by the patient flow coordinator following a decision to admit. Georgia has received treatment and is ready to go home with her mum. Both Magda and Georgia's doctors complete the discharge process for them before leaving the department.